Hello and welcome to Herbal Basics. In this module, I'll be speaking to you about arthritis relief. Now, what is arthritis? Arthritis is swelling of the joints, often accompanied with stiffness, discomfort, decreased range of motion, and pain. The hips, knees, spine, hands, and feet are frequently affected. There are many types of arthritis. The most frequent are osteoarthritis, which is the most common and involves wear and tear damage to the joint's cartilage. It occurs with most people as they age. Injury and overuse will accelerate it. Rheumatoid arthritis is caused by the immune system attacking the joint, beginning with the joint linings. It often affects hands and feet. Psoriatic arthritis causes inflammation of the skin and joints. It can affect any joint and cause pain and swelling. Ankylosing spondylitis affects the joints in the spine and pelvic area. Then there's gout, which is caused by the formation of uric acid crystals in the joints. How is arthritis treated? Treatment depends on a type of arthritis. This presentation will focus on osteoarthritis in the knees and the treatments that I, the author, have found helpful. Treatments that I have used include exercise, joint support, massage, heat and cold, essential oils, supplements, diet changes, shoes, proper walking technique, and rest. Now, let's speak to exercise and joint support. The exercises that I have found helpful for knee arthritis are the following, and this will deal with any muscle imbalance. So bridges and squats help with the glutes. Crab walks and clams help with the hip rotators. Now, I used to walk, but now I bike. And the reason for that is biking has a lower impact on the knees and feet. Now, Qigong and Tai Chi are very helpful. They're gentle and smooth movements. Tai Chi is similar to Qigong, except it's a series of coordinated movements, whereas Qigong is usually independent movements. Now, yoga is also helpful. It can strengthen muscles, support joints, and improve joint movement. Next, let's talk about joint support for the knees. Now, there's two types of knee braces that I've used. There's a neoprene, and neoprene is particularly helpful in the winter months when it's cold, and the neoprene will help warm the joint and it will improve its function. Now, the minus about the neoprene is that it can cause skin irritation. And when it does, it'll limit the length of time you can wear it. So the alternative would be a strap knee brace, which is usually made out of a cloth material. And you can wear it as long as you would like. Both of these you can find on the internet and Amazon, for example, and eBay. You'll have to try various designs, particularly the strap knee brace, to see what works best for you. Now, let's speak to massage and hot and cold treatments. Regarding knee massage, it can stimulate blood flow. It can relieve pain. It can improve your range of motion. And when you do massage with also massage of the quadriceps and hamstring muscles, it can provide even more relief. Cold treatments are helpful when there's a flare-up, so it can reduce inflammation and swelling by constricting the blood vessels. And also it provides pain relief. Now, hot treatments are useful to relieve muscle tension, to relieve pain as well, and to improve circulation of the blood flow. Here, I'm going to speak to essential oils and supplements. Now, the essential oils that I listed here are rosemary, frankincense, and myrrh. I've tried all of them. What I suggest you do is you take a 1 ounce glass jar, you fill it with your favorite skin cream. For example, I use Derma E, and then you apply 5 drops of any of these oils into it. Let's start with rosemary. You mix it, and then you apply it to your joint. In this case, we're talking about the knees, and see if there's any skin irritation from it. If there is none, then that's something you can use. Likewise, you could do this a similar test with the frankincense and with the myrrh. It's possible to mix all 3 of them if you want it, but I don't suggest it at the start because you need to use them independently to test for any kind of skin sensitivity to the essential oil. Now, the only caveat is that rosemary oil is a stimulant for some people. So you can use it in the morning and afternoon, say till about 5 or 6. But I suggest not using it at night because it may interfere with your sleep. versus frankincense and myrrh, they'll actually are sleep aids, so you don't need to worry about that. And you could use it therefore though during the entire day. Now, let's talk about anti-inflammatory supplements. These are all that I currently use. Um, ASU is it's short for avocado, soy, unsaponifiables, and it is an extract made from avocado and soybean oils. It decreases inflammation and is reduces cartilage breakdown, and it actually promotes cartilage repair. It's been around. It was developed in the 1980s in Europe, and it's finally made its way to the U.S. And it is the recommended dosage is 300 milligrams a day. You can buy it as 100 milligram capsules or 300 milligram capsules. I normally start with the lower dosage, so I currently take 200 milligrams, and if you need more, you can take more. Now, the boron is a trace mineral. It's naturally present in lots of plants and foods. Um, Now, it can reduce the enzymes that cause an inflammatory response and also reduce joint pain and stiffness. So the boron can be purchased in capsules that are either 3 milligrams or 5 milligrams. What I suggest, again, start with smaller dosage. So I buy the 3 milligram, and then you could slowly increase to see if you need more benefit, you could increase it. And I currently take 15 milligrams a day. Now, the pine bark has been around for hundreds of years. It was discovered in the 1500s by a French explorer in Quebec, Canada. It was introduced into the United States in 1987, and it provides pain relief. It improves the physical function of the joint. Um, Now, it is usually sold in 50 milligram capsules. I currently take 150 milligrams, but like I said, start small, and then if you need to take more, take more. I also find it helpful in addition to the knee. It's helpful for, I have arthritis in my small finger, my left hand. So in the winter months, it seems to get stiff and ache a little bit more. So in addition, so I take usually one additional um, capsule. So I would take, for example, 200 milligrams in the winter months to help with that. Now, MSM is a natural sulfur compound. It's been researched quite extensively, and has been proven to reduce pain and inflammation and improves joint function. Now, it is often sold in combination with glucosamine and chondroitin. Now, glucosamine and chondroitin have also been researched quite a bit. The results are mixed. In some cases, there's benefit. In some cases, there's not. Um, but I actually buy a capsule that contains all three: MSM, glucosamine, and chondroitin. And the Arthritic Foundation, excuse me, the Arthritis Foundation recommends a dosage of 1,000 to 3,000 milligrams a day of the MSM. I currently take 1,500 milligrams a day of the MSM. Now, there's cod liver and fish oil. You can take either one. I currently take cod liver oil. Both are good sources of omega-3 fatty acids. If you're taking, I normally get the cod liver oil with a little bit of a lemon taste to it because it's easier on your system with the little lemon in it. Now, both of them help modulate inflammatory responses in the joints. Now, with regard to diet changes, you need to follow a balanced diet, consuming anti-inflammatory foods such as fruits, vegetables, fish, and healthy oils. You want to maintain a normal body weight to reduce the burden on your joints, particularly the knees and hips. You also want to minimize these types of foods that can cause inflammation, such as added sugars, trans fats, particularly hydrogenated vegetable oils, gluten, foods high in omega-6 fatty acids and low in omega-3 fatty acids. You need both omega-6 and omega-3. The issue comes when you take too much omega-6 and not enough omega-3. Then you want to minimize refined carbs. Now here, let's talk about shoes, proper walking technique, and rest. So good shoes are really important to provide support, relief, and comfort. The qualities to look for in these shoes include stability and support, cushioning, a wide toe box, so they would accommodate swollen toes as the day proceeds. You want soft and breathable materials. You want an insole that you can remove to allow a customized insole, like for example, an orthotic. And you want, in addition to that, you want to focus on proper walking technique. So the feet, as you walk, should be pointed slightly outward. This will help with the proper with your knee issues. There's a YouTube video here that I found very useful in this regard. It's called "Does Walking Help Knee Pain?" Now, lastly, you need to rest your knees when you have a flare-up. You need to get off your feet, excuse me. You want to raise your legs in a recliner for 20 to 30 minutes. You can apply ice and anti-inflammatory creams as you're doing so. So that's it for now.